Hi, I'm Dr. Ojas Gupta, Assistant Professor in the Department of Pathology at SDPGIMS Lucknow. Today, we are going to learn about the normal histology of the kidney. So, why study normal histology of kidney? Or rather, why to study about normal histology of any organ? It's very important to know the normal histology to differentiate between a minor changes at the histological level of any organ. Kidney being a very important organ because the radiological and the blood and other biochemical parameters cannot accurately detect the histological changes, which are very important for any disease of the kidney. Hence, to understand, to know how to differentiate between normal and abnormal, to detect the changes at specific compartment or the region of the kidney, it's very important to know the normal histology or the normal structures of the kidney. To find the etiology, what is the causing the changes in the kidney, whether it is acute or chronic kidney disease, and to understand to precisely diagnose any mass lesion or any malignancy which is there in the kidney, and to detect the response to the therapy which the patient is getting. So with this background, the specific learning objectives of this session will be, first we'll go through the macroscopic anatomy of the kidney, like lobes, cortex, medulla, nephrons, renal pelvis, renal sinus, renal hilum, its vasculature. Then we'll straight away move on to the microscopic structures like glomeruli, proximal tubule, loop of Henle, distal tubules, collecting ducts, arteries, arterioles, peritubular capillaries, renal pelvis, and calyces. So we all know that we all are having two kidneys, and kidney is a retroperitoneal organ. Anatomically, it's a part of the urogenital system, and functionally, it's part of the excretory system, apart from the ureter, urinary bladder, and urethra. So for your understanding, there's a gross photograph of the left kidney, okay, which is having renal vein, renal artery, and ureter. And if we slice it coronally, so we can appreciate different anatomical structures of the kidney. Okay, so basically, kidney is divided into several lobes, and each lobe is comprises of medullary pyramid. So this is in the form of pyramid. That's why it's called pyramid, and the overlying cortex. Now again, these lobes are separated by septa of Burton, and this medulla, the tip of the medulla is called the papillae, where the urine is drained into the minor calyces, and then these minor calyces combine to form the major calyces, and all the major and minor calyces combine to form a renal pelvis, and then the urine is drained into the ureter. Now we all know nephron, the functional unit of the kidney. Okay, and each kidney is having approximately 1 million nephrons per kidney, and each nephron has got different subcompartments. So there are Bowman's capsule, proximal convoluted tubule, descending and ascending loop of Henle, distal convoluted tubule, and collecting duct. We will go through each of these subcompartments one by one. A very important aspect of the kidney is its vasculature. Okay, so if we, for better understanding, we have rotated this kidney into a 90-degree, and first, the renal artery. We'll start from the renal artery, which branches into the interlobar artery, which give branches to arcuate artery. This arcuate artery further gives branches of interlobular artery. And from each interlobular artery, there arises afferent arterioles. This afferent arterioles gives its capillary tuft to the forms the glomerulus. And from the glomerulus arises the efferent arteriole. From these efferent arterioles, peritubular capillaries or vasa recta is formed. Then again, blood is drained into the interlobular vein, arcuate vein, and interlobar vein, and then into the renal vein. So now let's move on to the microscopic structures. So microscopically, kidney is basically divided into 4 compartments. One is glomerulus, then there are tubules, then blood vessels, and interstitium. We'll go through them one by one. First, we'll start from the glomerulus. So as we have just seen, that glomerulus is a part of nephron, okay? And most of the glomerulus are situated in the cortex of the kidney. So if we take a section from the cortex, so at a low power vision, it will look something like this. So the glomerulus is something the round convoluted structures, and this is a H&E stained section. So in H&E stain, a cytoplasm is usually looked as a pink, and nucleus is looked as a blue in color. Okay, And so glomerulus is comprises of Bowman's capsule at the periphery, followed by parietal epithelial cells. So this Bowman's capsule is lined by parietal epithelial cells, and then there are capillary tufts. So we just saw the capillary tufts are formed by afferent and efferent arterioles. Okay, so this capillary tuft from the inside to outside, it is comprised of endothelial cells, followed by basement membrane, and then there are podocytes. Okay, so these are the podocytes. We'll look at the ultrastructure level also to see them better. Okay, so PS stain, periodic acid stain, is also very important to highlight the Bowman's capsule and see all the structures and different changes in the kidney. Okay. So now these capillary tuft also need some supporting structure. So these are supported by mesangial matrix, and these mesangial matrix are are having along with the mesangial cells. So these bluish structures are nucleus of the mesangial cells, and this eosinophilic component is the mesangial matrix, which is holding all these capillary tufts. So this is the further higher magnification of the single glomerulus and part of it. Okay, so we have just seen that this glomerulus is formed by this Bowman's capsule, followed by parietal epithelial cells. Now this coming to the capillary tuft, from the inside, it is formed by endothelial cells, and these endothelial cells have got fenestrations. This is followed by a basement membrane, and then it is followed by a podocytes or visceral epithelial cells, which have got a lot of foot processes. Now these three structures are very important for the proper filtration of the blood so that urine can be formed. Okay. In the normal routine practice, we see it under electron microscopy, and in this is one of the photo micrograph of the ultrastructure of the electron microscopy, which is showing the similar part of the glomerulus, which is showing the endothelial cells followed by Bowman's basement membrane, and then followed by the foot process of the podocytes. This is another pictorial representation to show how they look like. So you can appreciate these. So this is the inside. This is one of the RBC. This is one of the capillary loop in which endothelial cell is there. So this endothelial cell is having fenestration. This is followed by a basement membrane. And then there are podocytes. These podocytes are having foot processes. Okay. And then there are urinary spaces. And this urinary space is surrounded by the parietal epithelial cells. So let's move on to the next structure in the kidney compartment. That's a tubules. So first we'll see about the proximal tubules. So after the glomerulus, the proximal tubule arises. So this proximal tubule is they have got cells with abundant eosinophilic cytoplasm. So as the tubule, we know that tubule is usually a hollow structure. Okay, so we can appreciate that this is a tubules which is having a hollow structure. So they are having abundant eosinophilic cytoplasm because of the high mitochondrial content, and they are having the brush border. Again, the PS stain is highlighting the brush border better. Let's now look at the other tubules and ducts. Okay, so proximal tubules then give rise to the descending and ascending loop of Henle. So this loop of Henle, this will also be a hollow structure. And the important thing in the structure of the loop of Henle is that the nuclear protrudes into the tubular lumina, and they have got an attenuated cell cytoplasm. Then it forms a distal convoluted tubule. This distal convoluted tubule will have more cells per nuclei per tubule length, and each cell will have much less cytoplasm in comparison to that of proximal convoluted tubule. Okay. Finally, the collecting duct. Now, these collecting duct will have a lateral cell borders, which are very distinct. So this distinct cell borders are used to see whether this is a collecting duct. Okay. Now, again, at the histological level, the artery. So renal artery will be having endothelial cell followed by internal elastic lamina, followed by tunica media, okay, and then tunica externa. So internal elastic lamina will be there in case of renal artery, and it is highlighted by the refractile quality of the elastic lamina. Again, interlobular artery can also be visualized, okay. So interlobular artery gives branches and it gives branch into the afferent arteriole. Okay, and each arteriole is usually consists of less than or equal to 2 layers of smooth muscle cells. Okay, so we can appreciate that this is a glomerulus. This is a three-dimensional view, and if we cut a glomerulus, then in the two-dimensional it will look something like this. So if you can compare this three-dimensional structure, that afferent blood is entering from the afferent loop and it is forming a capillary tuft, and the blood is moving out of the from the efferent loop, efferent arteriole. Okay, so you can appreciate that this is one of the afferent arteriole. Okay, and the blood is moving out from the efferent arteriole. So you can appreciate, so afferent arteriole will be having a thicker vessel wall in comparison to the efferent arteriole, and it will have a larger caliber. Okay, so this is how we can differentiate between afferent and efferent arteriole on histology. Now something about macula densa. So macula densa is a specialized portion of the tubule, okay, that is adjacent to the juxtaglomerular apparatus. Okay, so it's a specialized part of the distal convoluted tubule. Okay, so here we can appreciate that this is the glomerulus and this is one of the distal convoluted tubule. Okay, so the cells which are adjacent to the glomerulus, these are columnar shaped cells, and these are called JG cells or juxtaglomerular cells. In the same histology, you can also appreciate these tubular structure. Now, this is a proximal tubule because it is having abundant eosinophilic cytoplasm and far apart nucleus. Okay. Now, let's move on to the other structure of the kidney, that is blood vessels or peritubular capillaries. So, usually in a normal kidney, the space between the tubules are usually insignificant. Okay, so but a very small slit-like spaces are seen, so which are usually in the form of which are the peritubular capillaries. Okay, these can be appreciated with the help of the small nucleus, and PS stain usually highlights them better because the capillaries will be having only endothelial cells and basement membrane. Again, immunohistochemistry can also be used. So CD31, which stains the endothelial cell, they are better highlighted in this immunostains also. So in a normal kidney, interstitium is very scanty. Okay, so usually it is not appreciated. Okay, so now let's move on to the renal pelvis. Okay, so renal pelvis. So if we magnify this area across of the kidney, which is the tip of the papillae and the minor calyces. Okay, so here the urine is going to drain. Okay, so histologically, this renal pelvis will be formed by the urothelial lining. Okay, but there'll be some certain differences, subtle differences between this tip of the papilla and the urothelial and the renal pelvis. Okay, so what is the difference? So difference is that the papilla will not be having lamina propria, whereas the renal the renal pelvis will have a lamina propria. Okay, as you can appreciate. Okay, so in the renal pelvis there will be presence of lamina propria, but it will be absent in case of tip of the papilla. Okay, so what is the urothelial lining? Urothelial lining is comprises of basically 3 layers. The superficial umbrella cells, which are present in the flat form. So these are the nucleus of the umbrella cells or the superficial urothelial cells, followed by intermediate cells, which are perpendicular to the base. Okay, and then this will be followed by a parabasal cells, which are round to oval shaped cells. Okay. So that's it. These are the sources from which this presentation was made. You can go through them. Okay. I hope you had a good learning experience. So thank you very much for your patient listening and hearing.